I guess maybe can you start by talking about why you started doing this treatment and why there are so few allergists who are doing it even now?
So oral immunotherapy, you described it. It's a way to get someone who may even be highly allergic to a food less allergic to it. It's not a cure, but you can build someone's tolerance slowly, gradually, systematically over a period of time. Um, as you pointed out, when we started oral immunotherapy in 2016, there was some small research studies at the academic institutions, but in terms of private practice doctors offering it in the region, aside from me when I started, there wasn't anyone. But you were driving up from Maryland. I don't think there was anyone in close by to you at the time. There was no one in Delaware. There was no one in South New Jersey. So I was at that time. I was serving a pretty large area. Since then, more doctors have adopted it, and it's at the time that I started, I was about one of about 70 allergists in the country who were offering it. So I had predecessors before me who kind of paved the way and taught me the ropes so that I could start offering it to my patients. And in the time frame that we're talking about, these 4 years, you've found an allergist close to you who's been able to continue that treatment. And I think that the number of allergists who are adopting this type of treatment is going to continue to grow exponentially. So it's good for parents to hear that and also recognize that while you had to make that 2.5-hour drive once a week to twice a month, nowadays people should be able to find physicians closer to home who can at least offer this type of treatment.
We're glad to see that increasing as well. Maybe for people hearing about this with food allergies, it's probably helpful for us to just start from the very beginning here.
Sure. So, basically these foods that kids are becoming allergic to, and it seems to be the same culprit foods over and over again: milk, egg, peanut, tree nut, fish, shellfish, and increasingly sesame. These foods account for 80 to 90% of food allergies. And in these cases, the body is recognizing something that should be harmless as a threat. And so it's mounting an immune response when it encounters these food proteins when they're ingested. The symptoms of an allergic reaction are pretty typical. They can range from mild to severe. They're unpredictable. And so it's the severe reactions that we're most concerned about because they could be potentially life-threatening. The reason that they can be severe is they can cause swelling of the throat or tongue, and that can obstruct the airway. They can cause respiratory symptoms like asthma symptoms. They can cause a drop in blood pressure. Generally, the types of symptoms are itching, hives, wheezing, gastrointestinal symptoms. So you can see that you can ingest a small amount of this food protein, but you can have a pretty systemic allergic reaction that, again, in some cases could be potentially life-threatening. Mild symptoms may be, an itchy mouth or a few hives around the mouth. It'd be reasonable to use antihistamines. But when those symptoms progress to respiratory symptoms, or if we're talking about a child and they're developing hoarseness or a repetitive cough, it could be that the reaction is progressing more rapidly. And in that case, you'd want to administer epinephrine, even instead of the antihistamine. Epinephrine is just adrenaline. It's the same thing your body produces when it's stressed out. But it has some remarkable effects when we talk about allergic reactions. It stabilizes allergy cells. In an allergic reaction, airways constrict, and epinephrine acts as a bronchodilator that opens up airways. In allergic reactions, you have swelling of tissue, and epinephrine reverses that swelling by acting as a vasoconstrictor, and so helping alleviate or stop that swelling. So it does a lot of very useful things in the setting of an allergic reaction. And actually, the sooner you use it, the more effective it tends to be. reasons we tell people to go to the emergency room if they have an allergic reaction and need to use the epinephrine has nothing to do with dangers associated with epinephrine. It is that, well, you've just had a bad allergic reaction, so you should go to the emergency room for further monitoring. That epinephrine can wear off, and sometimes those allergic symptoms can start to come back again. So that recommendation to go to the ER, sometimes people associate that with having used the epinephrine, but that's not really the reason we want people to go to the ER. We want them to go so that they can be monitored.
Another precaution, because the symptoms
Sure.
are so dangerous and can get out of control so fast.
Yes.
Right?